Welcome to the Pause It podcast. I'm Dr. Sam, and with me, as always, is Dr. Robert. How you doing today, Robert?
Good, Sam. How you doing?
I am doing very, very well, and we are going to talk today. So we kind of talked last time about something that we have in common, and this one kind of touches on something we have in common as well, and something that I think people are usually really interested to talk about, which is eyeballs.
Mhm.
And so common things we see in the vet clinic and common emergencies with eyes, which in my opinion, eyes are always urgent. What do you think?
Yeah, I think pretty much eyes are always urgent because the risk is that they can't see afterwards.
Right.
So it's very important to get checked out ahead of time. And just to preface this podcast for everybody too, Sam scared me when she's like, we should talk about this thing we have in common together as well. We both have pets that lost an eye. And in my head, I thought her dog Gus lost an eye recently. I was like, what? I was like,
You're like, what happened to
I was like,
Gus's eye?
Gus? So she scared me a little bit before we started this podcast, but yes, eyes are very important, and we're excited to share with you when you should be worried about them. But pretty much always something to get checked out with an emergency if you have any concerns, because they can get a lot worse by waiting.
And that is one thing that I will say is I always, whenever people call in and they're like, yeah, I'm a little worried about my dog's eyes. I mean, there are certain things that will help me to decide whether it's something that needs to come in today or something that can wait maybe until tomorrow. I
Yeah,
really don't have people wait more than a day, like ever, for eyes. They can go from
yeah,
bad to really bad really fast.
yeah. I would agree. Sounds like most time, again, it's just the vision part of it. If it's anything that's going to affect their vision or the eye is going to potentially perforate because of what's the underlying disease is, it's just something not to mess around with. It's better just get checked out real quick. And I think the only exception to that, if your dog looks otherwise super happy and alert, their eyes are wide open and they have a little bit like discharge and like sneezing, that's more like an upper respiratory infection type business. That is the That's more of a cat thing, to be honest with you. That's most of the time cats having upper respiratory infections. But outside of that, I can't think of anything else to be like, hey, wait a couple days.
No. Mm-mm. Not with eyes. I mean, my feeling is if it ends up being a fairly simple, straightforward like conjunctivitis or something like that, it's no skin off my nose to take a look and give you peace of mind and give myself peace of mind, honestly. So that is one of those things that our receptionists know. Like someone's calling about an eyeball. I mean, usually they'll know like the first questions are like, are they squinting? Like you said, like if
Mhm.
there is are their eyes wide open? Are they squinting? Are they pawing at the eye? Are they
Yeah.
rubbing it on couches? Are they rubbing it on the floor? Does it seem like they just can't get comfortable on that side? Um, I'm not as worried about like some drainage by this part of the eye.
Yeah.
That I'm not really that worried about. I think people
Yeah.
always think if there's green gunk that it must mean that there's an infection. That's not really always true. Um, and that in and of itself, like you said, not really an emergency, but pawing at the eye, squinting, constantly going after it, that can
Yeah.
go really, really bad really fast.
Yeah. Or just acting really dull. Like if their behavior is like significantly altered by it, that's something to check out because things like glaucoma can cause like a really bad headache for your dog. And when glaucoma is just increased pressure in your eye, but we'll get all the details of this as we go along. But
Mhm.
just it can change their attitude and they seem like really dull and out of it. That's a reason. That's the reason I knew my dog had an issue.
Oh yeah, me too with Phoebe. And that's the dog of
Yes,
mine that had the
not
same
Gus,
issue.
not my handsome guy.
You can pretty much guess that if there was one of my animals that had a problem, it was Phoebe. My
7 years down the
Frenchie.
line, we'll maybe talk about Gus when
Yeah.
he's a little bit older.
No. So far, Gus, his only thing is that eventually I'm gonna have to take a sock out of his belly, but no. That's eventual. That's gonna happen.
We're also doing like a guess the date for all of our consumers. So if you guys would
Right,
like to try
yes.
and guess the date that Gus has to eat a sock and we take it out, you can email us at podcast at myBalto, and the winner gets a free subscription to myBalto for the year.
Exactly.
I'm just kidding. We're not doing that, but maybe next time.
I mean, really, if somebody was that accurate, I would do that.
Yeah, I'll give you a free one. We have like 60 emails from people being like, I guess this date. I'm going to now watch it for the next 10 years.
Exactly. We'll
So,
have to set timers. Nope, wasn't today.
sorry. Oh,
Just don't
man.
come to my house and try to like feeding him a sock. That doesn't count. You're not allowed to
No,
do
I
that.
will win. Oh, man.
I will get this. Um, But yeah, so I think let's talk about like the most common thing. So I guess I'd
Yeah.
be curious to know because I know what I see most commonly. I'm curious what's the most common thing that brings somebody into the emergency clinic with an eye issue?
Most commonly is either a corneal ulcer, which is like an abrasion to the eye surface, or glaucoma, which is just increased pressure within the eye. Those are probably
Hmm.
one and two. Every once in a while, you get three is a foreign object in the eye or like around the
Hmm.
eye, especially if those of you live like around foxtails. Oh, they're the worst. They're like little pieces of grass that get stuck in every orifice of your pet's body, and
Oh
when they
yeah.
get near the eye, they are, well, I guess they're easier to take out in the eye than that nose, I guess. But they're horrible. So those are probably one, two, and three in that order.
Hmm. Yeah, and it's
So,
hard, I think, depending on where those foreign bodies go. I mean, that's difficult. I had a puppy one time that had a penetrating
oh,
object behind his eye. It was horrible. And like we didn't know at first because it didn't present like it just he just seemed irritated. It was almost like it just didn't make sense until it became
yeah.
an abscess, basically a retrobulbar
Oh,
abscess. So that
that's like I
just
want to
means
talk about
behind
too.
the eye, like it was around the eye. So yeah, that's a rough one. I mean, and I've seen some pretty crazy things where there's areas where cats and dogs get into crazy things. They run into branches.
Yeah.
And I would agree with you. I think corneal ulcers or abrasions or scratches, however you want to call it,
Yeah.
that's got to be the most common. And the thing is, it's really important that people understand that it doesn't always have to be traumatic. Like
Yeah.
there are dogs that will get spontaneous ulcers,
Mhm.
and they'll even get ones that are very slow to heal. And really need some help healing. So you have to go to somebody who's comfortable, helping to really heal that eye over time.
Yeah.
And so those can be really, really frustrating for people. I think that your average uncomplicated corneal scratch or ulcer, how, like what you want to call it, those usually heal really, really quickly.
Yeah.
But it is important that you have them seen and that, they're on, they have an e-collar on. That is probably one of the biggest reasons I see corneal ulcers not heal or get worse. And then sometimes get to the point of like the eye actually perforating. Um, is that people think that their dog isn't going after it, or I can take the e-collar off to let them eat, or I can just leave it on until it heals. Like,
Yes.
I can't stress that enough.
Yeah, I will second that strongly because you are never fast enough to catch their paw before it hits their eye. I don't care who you are. And every owner thinks they are for some reason. They're like, well, I'll just take it off while I'm hanging out with them because I'll be able to watch them. I don't care. They will still get it before you do.
Hmm.
And all you need is, unfortunately, especially certain breeds, like you hit it once and then you are able to get things like a perforation where things start popping out of the eye that shouldn't be.
Hmm.
And that's a medical emergency. And unfortunately, ophthalmologists are very hard to come by these days. And not everybody can, and they're the ones that need to do the procedure. So if you can't find one, your dog is SOL.
Yeah, it is.
Which is a bummer.
It's really hard. And where we are too. I mean, we were lucky enough for a good long while to have ophthalmologists from Purdue. They would come up to one of the close emergency clinics, and they would be there like once like every Friday.
Oh,
So
nice.
they would get a lot of things in that were not, immediate emergencies, but like something that was urgent that we could stabilize and then, whatever.
Sure.
Um, but now they're not going to be there anymore. So, I mean, people are having to drive 2, 3 hours to go to an ophthalmologist where I am.
Yeah.
And I mean, I can handle quite a bit of ophthalmologic issues. I'm pretty comfortable with like the first line interventions with things. But there definitely comes a point where I'm like, you gotta go. You know what I mean? There's a point to
Yeah.
which I don't, I don't have all the right equipment. I mean, they have some specialized equipment to be able to see things in a way better than what I can see.
Yeah.
And so, I don't ever want to do any harm to an eye. And so yeah, if your dog or cat has a corneal abrasion, you've got to keep an e-collar on them, like
Yeah.
100%.
Yeah, I definitely agree. That's and again, I think you mentioned it can come from all sorts of things. It doesn't have to always be trauma. It can be from some dogs have conditions where their eyelids like evert,
Roll
introvert,
in.
or roll in. Thank you. I'm like,
Yeah.
what's the right word? And their eyelashes cause the ulcer, which is
Yeah.
crazy to me. But it happens all the time.
Oh
So
yeah.
it's just a
Well,
simple
and
thing.
even some breeds that have a little bit, and that's called entropion, what he's talking about. So that's when the eyelid rolls in. Sometimes there are dogs that have it really mildly where it's not like the hair is not actually touching, but all it takes is just a little bit of irritation or inflammation to cause that to worsen. And so
Mm-hmm.
your dog that's been stable or okay for even years all of a
Yeah.
sudden has something else come along, and then now that's worse, and now they have this like the worsening entropion. Now they can't heal it. Like I had one dog that just as as she got older, she just
Mm-hmm.
lost fat, in her face, like around her eyes. And as yeah, and she had that kind of sunken in look, and
Yeah.
so she actually kind of got this entropion over time, and it
Oh,
made it really, really difficult because she just had so much redundant eyelid tissue that
yeah.
would just roll in. And then, unfortunately, she did end up losing her eye because she got a corneal ulcer that would not heal. And she's man, she's 16, and they had to remove her eye, and she did great,
That's
actually.
good. Hey, and we'll talk about that at the end of the podcast. But taking eyes out, it's our worst things. But
Well, I think too, like maybe we'll get onto glaucoma, which is another really big reason why we end up
yeah.
having to remove eyes. And yeah,
Mhm.
we'll definitely talk about that because, like I said, that's something we've both experienced.
Yeah.
Again, I think at different stages. Well, were you already a veterinarian when you took out Loki's eye? No, right?
No, I was a veterinarian at that point.
Oh, you were. What were you, like a couple of years out of school?
I was 2 or 3 years out because it was
Okay, okay,
2017-ish.
yeah, because I it was our
So.
fourth year when I took out Phoebe's eyes. Um,
Oh, was it? Ah, Phoebe, that poor dog.
I know, I know. It really is true. She's been through
Yeah.
everything.
It's,
Um, but yeah, so I think the corneal abrasions, like I said, like you definitely those need to be seen. They need to have an e-collar on, and they will usually have you have to put drops in the eyes to keep them from getting infected while the body does its job of healing. The
yep.
drops are not what's healing the eye, is just protecting them from getting infected, and then they
Yep.
won't heal. If they're infected, they won't heal. And your dog needs pain meds because it's painful.
Yeah. It's very uncomfortable. By far. Yeah. I can second that.
Yeah, and I put a contact on them too because I think
Oh, nice. Do you
it's
have
very
those?
comforting for most dogs when they'll stay in. They often pop out though. That's the only problem.
I haven't used those. Do you like them?
I do. I love them.
Okay.
I'm really lucky that I have a lot of really good optometrist clients. So they give me all of their samples. Like I have just
Nice.
bags filled with samples that don't have any prescription, and there's no like you don't have to buy anything really special. And so I just especially when I have to debride the eye,
Yeah.
and just for people who are like, what is she talking about? um if you when you have certain types of corneal ulcers that don't want to heal, part of it is because there's tissue on the eye that just doesn't need to be there. There's like part of it that's just it's not adhered to the cornea properly anymore, and so it has to go. In order for things to heal, it cannot stay there. And so if you take a sterile Q-tip, obviously you don't expect a person who doesn't know what to do with it to do this, but and so your veterinarian will go ahead and just remove that tissue, and that's called debriding. And a lot of times you actually make the ulcer bigger by
Mhm.
doing that. But that's a good thing because then the body's like, oh, I have to come heal this. And then the body will come in and
Yeah.
heal it. But it does irritate things a bit more. So I put the contact on for
It's a good
comfort's
idea.
sake.
I like that. I have to talk to our ophthalmologist about that, but she's wonderful. I got to talk to her more. So,
Yeah, Q-tip debridement. And then the big thing that I usually end up having to send those to if they just won't heal. So the non-healing ulcers is to get a diamond burr. Um,
oh, yeah. I know she uses that a lot. Like she used those
oh
for
yeah.
procedures.
Yeah.
But yeah, I guess I try to avoid that because I always get nervous around the eye. I don't know why. I don't want to make it worse. It's like
Yeah.
do no harm.
I
Number one
think it's
thing.
probably because you know how quickly it can go bad. And I think that again, like you have to, I really like eyes. I really like at one point in time, I was like, what do I want to do when we graduate? And, ophthalmology was definitely one of my favorite. I think we were on that rotation together.
It might have been. It's been
I
a long
think we
time.
were
It might have.
actually.
Maybe.
And I like eyes. I like the whole thing of it. I think it's really fascinating. And so to a certain point, I'm pretty comfortable doing some of that stuff. And they are kind of making a push for general practice to start doing diamond burrs because there aren't enough ophthalmologists, and it is something that
Mm.
is quite reasonable for a lot of people to do. I don't do them yet, but it's one of those things that I'm trying to maybe start doing because I don't want to
Mm.
have to make people drive 3 hours to get something that I definitely could do.
Well, let me know if you do. I'm very
Yeah.
curious about it.
I do. I will let you know. But anyway, so kind of the next thing that you mentioned that you see pretty routinely, glaucoma.
Yeah, glaucoma is a tough one with, and that's just like I said, increased pressure within the eye. There's a bunch of different causes for it. There can be like secondary causes, like things like the lens in your eye moving forward. Um, I'm trying to think of all the secondary causes for it right now. Cancer and a few other ones that can cause that pressure to increase. But at the end of the day, it's very uncomfortable. That's the one thing I can say for certain.
Mhm.
That's actually how I knew it. My own dog, like he's eating every meal every morning, like clockwork. And the one morning he didn't eat was the morning his pressure in his eye was like 95 or something like that. And
Yeah. Oh
it
yeah.
went from like 0 to 9. Like normal pressure for a dog is like 20. And I was like, why are you not eating? And I was like, oh, maybe just got a corneal ulcer. So I went to work. I stained it real quick. And this is just after an overnight, too. So I'm tired as all hell. And I get there and I'm like, oh, no ulcer. I'm like, no, please don't tell me this. And of course, his pressure was through the roof. And that day, I remember I actually tapped his eye, where I put a tiny little needle into his eye to pull out a couple drops. The pressure went down because medications weren't working. So
Oh yeah.
yeah, but he has a
Yeah.
unique eye disease that was different than most dogs. So
Well, and that's what I was gonna say. I mean, like glaucoma is such a hard one because there's primary glaucoma, there's secondary
mm,
glaucoma. I mean,
yeah,
there are, like you said, a lot of reasons why it can happen. So don't panic. I mean, definitely get your dog. Like if you're noticing that for Phoebe, what happened, and of course, I went away, and so Paul was watching Phoebe, and she literally, I think he even said to me, like, I don't think she can see. Like, I think she's blind. Like, I don't think she can see.
yeah,
And she was just holding her head like this. Like she just wouldn't move. Like it was almost like she was just too painful to move. And that's what
mm,
they say. Like it just feels like a migraine.
yeah,
Um, and so I think I was gone for like 3 days or something. And so by the time I got back, we checked her pressures. And I think they were in like the 70s or something like that. I don't think they were quite
wow,
as high as Loki's, but they were
yeah,
high and meds were just not bringing them down at that point. But that's because at that point it was probably too late, which is another reason
mm,
why if your dog, if you think, especially if you're noticing that the globe of the eye is like very prominent, you think that it looks
yeah,
big, go and get your dog checked because there is a time period with which if you get those pressures down, you can get eyesight back in that eye.
yeah,
Um, Now I think it's important to know that dogs don't really mourn the loss of eyesight. I feel like they really don't. Like they don't care if they're blind. They care if they're
mm,
painful, but they don't really care
yes,
if they're blind. And so with glaucoma, I think people get really like, oh my gosh, like what if I suddenly couldn't see? Like how terrifying or how, especially like when an animal you can't really explain it to them or they can't really tell you how they feel.
yeah.
And I think it's important that people realize like dogs really adapt incredibly well to being blind.
Yeah, blind or removing one eye, like one way or another, they do really well. Like Loki has lived his best life since losing his one eye. He's
Oh
built
yeah.
a lot of character from it. He gets a lot more attention now because everybody
So
thinks it's really
cute.
cool. It's
Yeah.
adorable.
He's always winking.
Um, and he's winking. He's always winking. But I agree 100%. Like dogs are amazing. They really do not care. They're just like, great, I feel fine. Let's go party. And they are ready to keep going
Oh yeah.
almost like the next day. They do really, really well with it.
They do. Like you take away their sense of smell, I think you'd have a big problem. But
Yeah,
but
I would
you
agree.
yeah,
It's
but
a
you take
bigger
away
issue.
their eyes, they're like, meh, wasn't really using those anyway.
God gave you two, gave you a spare. So I'm just
Yeah.
kidding.
Well, in my case, it was bilateral glaucoma in Phoebe.
Yes. And Phoebe,
So
Phoebe
so she
loves
went
both.
blind in both eyes. And that was what I was going to say is that we couldn't get her pressures down so much like Loki. We couldn't get her pressures down. And the ophthalmologist and I was at MSU. I mean, it was we were still in school and he was just like, I'll be honest with you, like she's painful, she's uncomfortable. This is like having a you know, a headache all the time. Like if her pressures don't come down with the meds, then he was like, truthfully, I would just take her eyes because she's not using them. She can't see anymore. But that would
Yeah.
just immediately take the pain away.
Yeah.
And so I was like, okay, that's something that maybe I really do need to consider doing for
Was that
her.
hard for you at that point?
It was very hard for me because at that point, I had never even considered the idea of suddenly just, oh my God, she's just not going to have eyes. And I will say that the service, like the ophthalmology service, was so awesome about it. Like they showed me videos of a dog that was navigating a room blind, and like, you know, they talked to me about they have these little like scent patches that you can put around your house that will like mark, help them to know like how to map your house. Turns out
Yeah.
Phoebe's sense of smell was terrible, so they didn't work for her. But like for a dog that can like smell, it would work really,
Well,
really well. They're called trackers, I think. Um, and so basically but she did great. I mean, she was an older dog at the time when it happened, but she lived another couple of years happy as a clam. She couldn't see, but she was happy. And
yeah.
she still played. She still wanted to be around us. She still, you know what I mean? Like she was still really enjoyed her life. She just couldn't see. Um, and so they made me kind of realize that was okay. Like that I didn't have to say goodbye to her just because she couldn't see anymore. And then
Yeah.
ever since then, it's taught me so much about how to talk to people about when this is happening to their dog.
Yeah.
Um, Especially if it's just one eye. I'm like, that's nothing. They're totally fine. Like my dog got lost both her eyes. She did great. You know what I mean?
And I think that really like helps to hear that from you because like you're like, hey, I've had a dog that lost both eyes. They were blind and they did phenomenal afterwards. And I think it's like 100%. It's okay to be sad. Like I definitely cried the night before he had his surgery because I felt how like I was like, this is my beautiful dog. Like he's about to lose his eye. Like he was in
Yeah.
so much pain. I felt horrible because I couldn't control his pain. And then afterwards, you're like, it's okay. So it's okay to be sad about it. Like obviously you feel bad for your
Oh
pet, but
yeah.
more feel bad for the pain that they have more than the loss of the eye. It's kind of like some people, probably not quite the same attachment, but like some, I would say male owners really are big in holding on to their dog's testicles because they feel like their dog cares. I'm gonna say your dog does not care at all. So
True.
just as an FYI for all you, and
And
I
for
get it.
those that do, there are nudicles. So
There are nudicles, so go for gold.
that is
Um,
prosthetic testicles for anyone who doesn't know what we're talking about.
it's my favorite podcast so far.
I was
Anyway,
gonna say, wait, do you come across those very often, just out of curiosity?
more his owner's like, well, I don't want like he needs those. I was like, no, he doesn't. I was like, he is fine without them. I've had a couple more. I think I saw them back when we were in school, actually, more than anything else. Where I'm just
Oh,
like,
really?
yeah, they're like, I don't want to do to my dog. It's like he needs those. I'm like, no, he doesn't. He does not need them.
I've only
But
ever seen him one time when I lived in California and I was working in Beverly Hills at a
oh yeah,
veterinary clinic. Oh yeah. And the thing that's funny is it was a Great Dane and they were not very big nudicles.
oh, I was like,
They were like one size fits all. I'm like, not the Great Dane.
or not Great Dangerly embarrassed right now. He's like, they're
I
fucking
know,
nothing.
right? I know. He's like, don't talk about my nudicles. They also are very hard. They're not soft like a testicle.
Yes, they're very hard. I got to change
Sorry,
subject.
I know. I know people are like, can we talk about eyes again? Stop
Yeah,
talking about nudicles.
we'll bounce back to the eyes.
We'll bounce back to the eyes now, but just so you know, go ahead and research nudicles.
Yep, it's a great
Oh,
conversation
speaking
starter.
of which, so do you ever put a prosthesis in the eye?
I'm gonna need a minute. Just excellent transition. That's why we planned it this way. Uh, I know a few people have gotten them. Yes. The issues with them, the benefits is that it looks like they still have like an eye, at least when their eye is closed. Like it fills in the gap that it
Yeah,
doesn't look as sunken for owners that are considering them. The downside is they can get infected at some point.
yeah,
And sometimes it's not worth the risk of having to open the eye up again, take it out, they get infected. So I think
yeah.
that's my only reason for not to. And honestly, most dogs have so much hair covering their eye, you can't tell. I don't think it's worth the money or
Mhm.
the concern for infection later.
Yeah, because you're always, even though like technically it's an inert thing that should be okay there. I agree. The only one I've ever seen that dog had problems with it, like every, you know what I mean? Like, I don't think they ever went back in and had to take it out, but like every once in a while, I don't know, there something would act up in there and it was not good.
Yeah.
Um, and so I agree. Like most of the ones that I've done have been on fluffy dogs, and they look so cute. You know what I mean? They just get a bunch once their hair goes back, they're all
Yeah.
fluffy.
It's
They
like
look
a
great. You know, Phoebe didn't have any fluff, and she definitely lost. You know, because all those muscles kind of atrophy there.
yeah.
I think the probably the most off-putting thing is nobody told me that she was still gonna blink.
Yes, they still do blink. This is something I noticed with Loki the other day,
So it's
a
like,
while back.
yeah, I feel like
Here's
it is very weird that they still blink because it's like,
yep,
why? You know, they don't need to blink, but yeah, they do. They still
yep.
blink.
The reflex
Um,
is still there.
and I think the other thing that you should prepare for too, if your dog ever has glaucoma, is that depending on why they have glaucoma, um, you're gonna have to treat the other eye, and the chances that it's gonna come into the other eye eventually are pretty high.
Hmm.
So I have one dog that had like juvenile, like very young congenital glaucoma type thing. I
Yeah,
guess
bummer.
I don't know. I don't remember exactly what it was. But he was very, very young. I mean, like I think that we had to enucleate his eye before we castrated him. Like he was
Wow.
young. And he went to Purdue, like he did the whole thing, but we ended up doing the
Yeah.
surgery and we've had to check his pressures routinely in his good eye. I mean, his whole like he's like 2.5 now. And I think
Poor
I saw
guy.
him like every month for like the first year. And then now I see him like every 2 to 3 months, making sure
Hmm.
that that other eye is doing okay. And they have to put drops in it every day. And they do. They're
Yeah.
great owners. They come and they take care of it really, really well.
Yeah. And we should say that enucleation is not the only option, I think, as well. Like, I don't want to scare people to think like once their dog gets glaucoma,
Oh
they're
yeah,
they
no.
get their dogs. Like, we start with drops in most cases, and those are ineffective. There are some other procedures you can do. I think it's like a ciliary body ablation or something like that, CBA. That's
Yeah, it's with Sidofovir. Yep.
yep. So there are other procedures we can consider beforehand. And ophthalmologists, God bless them, they will always try and save the eye. They will do everything they can to save the eye before they have to nucleate it. It's like their credo, and they do a great job with it.
Oh yeah.
If you talk to an ER veterinarian, I'm like, oh, just take it out. But
You're like, we'd be
ophthalmologists are,
done. We'll be done.
yep,
One
we'll be
surgery, we're
done.
done.
Yep.
Um,
But they're really good about making sure like they're gonna do everything in their power to keep that eye in there as long as they can and healthy and pain free.
yeah.
That's the big
And
thing.
I will say I actually have had a handful of glaucoma patients that, yeah, they're blind in that eye, let's say, like they can't see, but they're not painful. Like
Yeah.
their pressures are controlled and okay, they're blind, they can't see. Um, but you don't have to remove those eyes. I think
Yeah.
that the only reason why you would consider doing the enucleation or removing the eye is if you have intractable pain, you can't control the
Yep.
pain, which is what was the case in both of our cases, I think.
Mm.
Um, and you know, like if it's like one of those things where they're blind and you know what I mean? If you're like, I don't want to do drops for the rest of their life, then it's a totally reasonable thing to do. But what you
Yeah.
mentioned, the injection, I've had probably 3 patients choose that
Oh yeah.
instead of the enucleation for a couple of different reasons. One of them was just so old. The owner did not want to put him under anesthesia. He had a lot of other health issues and he just was like, I don't want to take the anesthetic risk. I just don't even want to put him under anesthesia. I think the dog would have done fine, you know what I mean? But again,
Sure.
like that's totally reasonable. There is risk with anesthesia. And
Yep.
and so the ophthalmologist was like, well, I mean, before we do that, then let's try. Let's see, you know, and if this works and it controls his pain. And what happens basically is the eye gets really inflamed for a little while, and then slowly it basically just becomes really small and just kind of sits there and doesn't really hurt anything, doesn't really do anything. It looks abnormally small compared to the other eye, I'd say after.
Yeah.
But all of my patients that went that route all did great.
Yeah. They can do really well. So I don't want people to panic here, but like I know we jumped right into enucleations because it's something that's both personal to both of us.
Yeah, yeah, yeah.
Uh,
And that's just because
yeah.
that was the outcome for both of us. And I think it's
Yeah.
because it is so scary to people that like I always want to just
Yeah.
try to like reassure like if it does come up and you do have to lose the eye, don't worry,
Yeah.
it's okay. You know, they're going to do fine. But I agree. I
Yes.
think you can I mean, you can also manage glaucoma with meds for a long time in a lot of cases.
Yeah. They can do really well for a while. So
Yeah.
yeah, it's I'm talking to my ophthalmologist one day, see if she wants to hop on and talk about like the biggest misnomers with eye care because she's super nice. I'm sure she'd love to talk for a bit. So
That would be
see if
so
she's
fun.
interested.
I mean I just love like I've been so lucky that all the ophthalmologists that I've referred to and worked with have
Mm-hmm.
been super, really just like friendly, nice, and also very kind with their time. Like
They're the
they'll
nicest people.
I know. They'll answer all sorts of questions. I think they're really, really patient. I mean, I think you must have to be, right? To like do something that's it's quite tedious. I think some of like the stuff that they have to do is really small and they have to
Mhm.
be like I would imagine you'd have to be pretty patient in order to be a an
I think
ophthalmologist.
also their quality of life is just better than ours sometimes. I think sometimes it's just like I'm like you're just always, and we put our ophthalmologist through a ton, so she's a lovely person for all the referrals we have for her and consults. But I think it's nice that it's 8 to 5 most of the time. It's very controlled most of the time, except for all
Hmm.
the emergencies I throw at her. But
Yeah. But I would
that
say that because I mean, there's probably residents, right, that do or not where
we
you
don't
are.
we don't have residents at our hospital for
Mm.
ophthalmology, unfortunately. But we're trying to get more, trying to get more
Yeah, I was gonna
people,
say it is actually one of the hardest residencies to get in veterinary medicine.
which we
If
got knocked
not,
that off because we need
I
more
think it might actually
ophthalmologists
be the hardest, I think.
next to zoo, maybe
Hmm? Which
next
one?
to zoo medicine.
Oh, yeah. I don't even I mean that's a whole nother
Yeah, it's a whole, I think.
story.
But yeah, probably in terms of specialty, I think ophthalmology is one of the toughest ones
I
in
think
terms
it
of like
is. I
the
think it's because
small animal sciences.
there's not very many programs.
No,
So
there's
it's
not.
very, very hard to get into, very, very competitive.
Yeah.
Um, and then what did you say was your third thing that you usually
Foreign
see?
bodies. I think foreign bodies was the third one.
Oh, yeah. Yeah.
Yeah.
I guess I don't see those very much. Those probably go to you more than me.
Yeah, I just think it's just like grass awns or foxtails that get stuck in around the
Mm-hmm.
eye. And those are, can cause ulcers. So that's often like a common sequelae of
Mm-hmm.
that. But otherwise, those are kind of the big three. You can also get things like anterior uveitis, which
I
is
was
like
gonna
an
say I see a lot of uveitis, but the
yeah,
thing about that and all that is inflammation, to
yeah,
put that pretty like succinctly. But that can happen for tons of reasons and things that like sometimes a dog comes in with signs of uveitis and I've diagnosed entire other diseases that have nothing to
yes.
do, like the eye is the pathway. It's like, oh,
Mhm.
this is how we knew there was a problem, but now and I mean it can be anything from, unfortunately, I diagnosed lymphoma that way, I diagnosed ehrlichia that way.
Mhm.
I mean, just crazy thing. That's a tick-borne illness. I mean, like really the eye is definitely such an important part of the body and is affected by so many different things. And so
Yeah.
yeah, uveitis, the tricky part with that is sometimes though they have uveitis and you'll never know why. Like 50% of cases it's like you look for everything, but you can't find it, and then you treat the uveitis.
Yeah, I just had a cat with that actually. That really nice cat, but I ran all the tests, like literally all the tests, and there's just
Mm-hmm.
nothing. And I feel bad because the eye is getting worse despite that. So it's not a fun one. It's probably my least favorite of the eye diseases to manage
I think
because
because it is so vague. You know what I mean?
yes,
Like you have to get really lucky to find the cause. And
yeah,
sometimes you get lucky to find a cause you can fix, and that's what you want. Every once in a while though, like you find a cause that but man, the one that had Ehrlichia for me, that was a crazy ride. And that dog's doing great today. So I mean that's a
yeah,
really like in the end, like a really happy story. That
yeah.
dog has survived like everything. That dog's amazing. And she's just like, just this cool little dog. She's got this great little personality. Um, she ended up with the pyometra too, like this poor little dog. But yeah,
Poor.
yeah. Well, she's from another country, and so like
Oh, okay.
and so that's actually I think where she was exposed to the Ehrlichia.
Makes
And
sense.
it was like one of those things where they were moving a lot, and then they were here and they were there, and like they never spayed her, and it was just they just never, I don't know why, but they never chose to. And then so yeah, so we had this whole thing where we went through the Ehrlichia with her, and and then
Mm,
just the last time I saw her, I was like, well, she's got a pyometra now. Mom's like, all right, well, let's do it. She's got this great owner, so she just took care of everything. But that was how we figured it out, was from the eye.
yeah.
So it's crazy.
Oh, that's interesting. I like that. I'm glad you figured it out because you don't always hear the cause, like you said. So it's nice to have an answer.
Yeah.
That's
Oh
why
no,
we're in
I've
this
definitely
field.
had my fair share of ones that we never found the answer. But the
Drives
eyes
me
get
nuts.
better if you treat the uveitis kind of primarily
Hmm.
often. Maybe not with your
Yes.
cat, I'm sorry.
Yeah.
But if they end up enucleating, you can send it to Michigan State because they have a really good pathologist that does
Yep.
a bunch of iPath, which he was
Yep.
our teacher, remember?
Stop.
Todd Sledge.
I was like it's Todd or something. Yes, I
Yeah,
do
yeah.
remember him.
I
He
think
looks
I
like,
have to send him the eye that I literally just removed yesterday. So
oh yeah,
yeah.
he reminds me of the guy from Criminal Minds. The really
Oh
smart guy
yeah. Yeah, the really smart guy with the
with the
yeah,
long
because he was
hair, and
super smart. Yeah,
he
and
was
just
very smart. I'm like,
super nice guy too, really, really
yep,
smart and loved eyeballs and
love
it's
eyeballs.
really cool. Because even
Yeah,
like being here, like everyone from Purdue just like sends him all the eyes, you know? So
yeah,
that's gotta be pretty cool to be like the best at that, you know?
yeah.
So
You're the
and
eye
not
guy.
to impugn any other, I just don't know any other ones, so I'm not gonna say, but
Yeah, I was
he's
like,
really good.
in all
So
respect to other
don't want to
ones as well.
offend anybody, but he does work at Michigan State, so to be fair.
And there go
I
half our
even have
users.
my Michigan State shirt on today.
And I
Um,
have my glass.
there you go.
I think so. So,
But some of the other things that I see, I think one of the most common eye issues I see, I wouldn't consider it like I'd say it's urgent, but not an emergency. It's just like any kind of conjunctivitis. So whether it's like bacterial, viral, you know, there's lots of different causes for conjunctivitis, and so those are we see those all the time, and that's
yeah.
very, very varied.
Mhm.
Um, you mentioned to me when we were talking about this before, like one of the other things that we do see a lot of is dry eye.
Oh,
So,
yeah, yeah.
KCS or dry eye.
Mhm.
And sometimes the way that you even find that is that you're either seeing like a lot of times where this dog's coming in with conjunctivitis and they're just get these recurrent infections because those eyes when they're not making normal tears are really open to infection. They're
Oh,
also really open to getting corneal ulcers and other
yeah.
things. So a lot of times you're going to be like, okay, well, let me just do a full ocular exam. Like, let me check everything. And then you
Mhm.
check their tear production and you're like, whoa,
Exactly.
that's
And it's
not
more
good.
common in your little breeds too, like your pugs, your
Mm-hmm.
Shih Tzus, all those little tiny ones that have,
Bulldogs, English bulldogs are very, very
yeah,
predisposed to
English
that as well.
bulldogs. So yeah, they're winners in that department, unfortunately. But they're
Yeah, I
very
think
cute.
I think you add the word bulldog to anything, and then like you're pretty much like, yeah, and that too. So they get that also. But yeah, and there's ways to treat that as well. And that is going to be something that's going to be like a chronic management. That's not going to be hey, we'll get over this little hump and then we'll be fine. Like
Yeah.
it's lifelong management. And actually Phoebe had that before she got glaucoma.
I'm one day going to write a list of all the diseases that BP had.
You should. I I
And
I mean it is shocking how many
then I'm
things
going to
that
teach a class at Michigan State or something like that. Like, I'm
called
going to teach
Phoebe
you
the
most you need to know.
Frenchie.
Yep, exactly. Teach you most you need to know about veterinary medicine with one dog. Um,
Actually, you know what? You could do like a really good case-based learning class, just being like all the things that happened to Phoebe, and then like present her clinical signs, and then like
mhm,
make the students figure out what it was.
exactly. It's a great learning exercise.
Yeah, I know. I think I was just really lucky to work with really, really smart veterinarians that I just got super lucky with who I was around because she got
Yep.
such great treatment and yeah, I can't take credit for any of it except that I just would be like, smart person, here's my dog.
Fix them.
Right, fix her please.
Yes.
All too often, but yeah. And she used to get corneal ulcers like it was going out of style.
Yeah, it's a pretty common thing with the smush face,
Well,
unfortunately.
that's what happens when their eyes are set so far forward. And we lived in California and we used to go to the dog beach and she
Oh,
loved going to the dog beach. And literally, I got to the
oh,
point where I tried to put doggles on her because I was like, I just don't
that'd be
want her to get
adorable.
another
Seeing her,
corneal.
and
She
that'd be
wouldn't
so
wear them.
cute. Oh
She wouldn't.
no.
But I did actually start lubricating her eyes before we would go.
Oh, nice.
And then
Smart.
that would really help. If I lubricated her eyes before and we didn't go for too long, then we'd actually go and like not come home with a corneal ulcer. But I got to the point where I just like she would just like come at me and I'd be like, oh, we gotta go to the vet. Like
Wait,
I
I am
already
the
know
vet
what
now.
this is. We gotta go to the vet.
Oh man, that's funny.
If
Oh,
only I
Phoebe.
had like one of those cards, like those like punch cards. Like, oh, you're here again. Next one's free.
You know what? We'll start thinking about that for my Balto punch card system.
Yeah,
Yeah.
exactly.
So
Buy one, get one free for your dog.
next brilliant idea.
Well, you have a dog that has enough issues and then you figure it out.
Yep, definitely.
But
Um,
yeah, but I think ultimately the take home here would really be just if you think something's going on with your dog, have them seen, call your vet, explain what you're seeing, take a video. Like you said
yes.
before, Robert, take a video. When all else
Thank you.
fails, we get so much information from that and I would love to not be guessing because sometimes I'll hear the version of what they told the receptionist is going on, and I'm like, oh, okay, that sounds like that could wait, you know. And then I'd feel terrible if I said that and it was something that couldn't really wait, you know.
Yeah, I agree. The videos help a lot. They honestly pictures, videos. Videos are always if you're gonna take a picture of your dog's eye, use the flash. It makes things a lot easier.
Hmm.
So just a little hint.
I'll have to think. I mean, I take pictures of dogs' eyes like all the time. I'm like, do I use the flash or do I just use a really bright
Sometimes it
green
works
light
great when you
above
don't.
me? I don't know.
Yes. Sometimes you don't need like if you have light behind you, it's not a big deal. But like some owners like try and send a picture of the dog's eye, and when you use the flash, it highlights things very well.
Mm.
So just if you get a chance, you send that eye picture in. I'd love to see it with a flash. So
And you can always send pictures of your dog's eyes or questions
more importantly,
to
questions.
podcast@mybalto.com.
The number of emails we're gonna get this next week between the number of guesses for Gus's sock day,
Oh, I know.
number of eye photos,
And
not
then
one
like a
question.
whole bunch of pictures of eyes. It'll be like, actually, you need to send this to your vet. But if you do have questions, we'd love to answer them. That's always something that we're interested in doing. Answering questions. And you know, one of these days, one podcast will be about that.
Can't wait.
Well, this has been the Posit Podcast. Thanks everyone for coming by.